Welcome to Learning Unit number 5. In Learning Unit number 5, we're looking at accessing, so the ability of our vulnerable populations to access and pay for healthcare. So we know that hospitals and other healthcare organizations need to continue to build and maintain strong linkages with the community stakeholders, and that's in order to ensure that the needs of vulnerable populations are supported and that healthcare disparities are diminished. So, this includes identifying barriers to healthcare, health priorities, and aligning efforts to address them. Even the Joint Commission now, as of January 2023, has specific requirements for hospitals to decrease their healthcare disparities, and they speak to the barriers to healthcare. So we know that improving access to care and the value of care in vulnerable communities will involve developing really innovative ways to use what we all know to be limited resources and develop and transform our care for changing communities. So, in this unit, we're really looking at the community benefit obligation, so community benefit that hospitals have who are tax exempt and nonprofit. So, if a hospital is a nonprofit hospital, in order to receive this tax exemption, which is about 50% of our hospitals nationwide, they need to, they're obliged to follow the community benefit. So we're going to look at that. As part of the community benefit, hospitals need to do a community health needs assessment every 3 years. This needs assessment forces the nonprofit hospitals to really look outside their walls and engage new partners. So it's important for us as nurse leaders to be aware of this community benefit and to have a better understanding, and then to reach out into our own organizations to see who is leading this. And nurse leaders really need to be aware of the health-related social needs of their patients in order to ensure access to healthcare services. So we're going to complete this learning unit with the development of our problem statement for our vulnerable population. So this week is extended because we have the Thanksgiving holiday coming up. So it's actually a longer week, which I hope will allow you to really spend some time with the readings and complete your learning activities. So you're going to be doing a few things for this learning unit. First is reading chapters 8 and 9 in Compassionomics. I imagine some of you have even gotten ahead, but which is great. But minimally, that's the 2 chapters that are in this learning unit. There's a relatively new article that came out that I think is really beneficial when we talk about paying for health care. We're not getting into medical debt because there's just not time to get into that, but that's a significant issue in our country, is the numbers of people that are going into medical debt and the amount of medical debt that many have. So this speaks to the certain groups that really don't know how to navigate the U.S. healthcare system and therefore are more likely to get into medical debt. They're unaware of financial assistance programs that hospitals offer, such as charity care, that's part of the community benefit. And this really increases the likelihood of their not only getting into medical debt, but not accessing health care because they are aware that they're getting further and further into debt. So it's a brief article, but I really found it to be beneficial and at least our beginning look at at accessing and paying for care. So then there's readings in unit for this unit. So you're going to want to read this, and you're going to want to read these articles prior to doing the discussion board. So let's look at the discussion board first. And it's speaking to, again, the community benefit that nonprofit hospitals are obliged to follow in order to maintain tax exempt status. So what I'm asking you to do is, and again, not again, but no replies are required this week. But what I'd like you to do is share a summary of what you learned about the community benefit. But make sure your summary includes the fair share spending. In your readings, you'll better understand, but the fair share is really how much hospitals receive in their tax exempt benefit, which is a large sum of money for many large hospitals, and how much these hospitals give back to their communities. So you would think it would be all the money, right, that they receive in tax exempt benefits that they give back to their communities. But that's not the case, and you're going to find out more about that as you do the readings. Some hospitals give back more, others significantly less, and you're going to look at how they give back in charitable care, meeting the low costs of what they're reimbursed for Medicaid. So it's very, very interesting. And then you're going to reflect on the community benefit and the possible impact on your vulnerable population. Maybe you don't see an impact on your vulnerable population with this community benefit, but I ask that you at least look at that, because I think in most cases you will. So and then finally this is the final assignment, is completing your development of the problem statement. So that's vulnerable population assignment number 3. So this is truly going to be the last major assignment for your specific vulnerable population. So looking at the readings for learning unit number 5, I gave you a brief summary of those readings. But this is first, how should nonprofit hospitals' community benefit be even more responsive to healthcare disparities? So this really gives you more of the history of the community benefit. How did it come about? Who oversees it? That kind of thing. And so we learn more about that. And then we learn that there's 4 policy proposals that will enable this community benefit to spend on health equity, which really will help to eliminate some of the healthcare disparities. So this is a really nice article that gives us a good idea of what community benefit is. And then this comes from the Lowen Institute. And once you click on this, you're going to do a couple things. So that when you click on, you get to the link, 5 things you need to know about hospital community benefit spending. So read through those 5 things. Then in the same link, the first paragraph of it has a link to the fair share spending. So I want you to also look at that information. So I didn't put them 2 different spots. It's the same web page, but I want you to go through and first read the 5 things you need to know, and then come back, click on that fair share spending link in the first paragraph of your readings in this. And I want you to look at the following sections. Key takeaways: hospitals with the largest fair share deficits. That means they don't give as much as they get back in tax exempt status. And then hospitals with the largest fair share surpluses. So that's hospitals that give more. than what they have received as far as in their tax exemption. So and these are our hospitals. So it's interesting to look at this. I'm not saying so much to judge, but just to know that it's different and the key takeaways. And again, when we talk about fair share deficits, we mean that they spent less on charity care and the investment in their community than the value of their tax exemption. And of course, the surplus would mean the opposite. So I also, if you have an opportunity, just click on when you access this link about loan, LOWN, where this information is coming from. And you're going to see who they are. So you're going to click on the about link and you're going to see who they are and their philosophy. They really have a phenomenal philosophy because I like to know where am I getting my sources of information, and I was not familiar with the Loan Institute. It's a nonpartisan think tank that advocates for bold ideas for a just and caring system for health. So if you look at their philosophy, it's pretty incredible. So, but I want you to know that, it depends on where you go for information as far as sometimes what you're finding. So, always, if you have a chance when you're at a site that you're not familiar with, click on the About link and learn more about where this information is coming from. So then you're going to, and this is the last required readings, is the community benefit analysis. Now this was published by the American Hospital Association. So you might see things a little bit differently reported in this article and then in this. I'm not saying that the American Hospital Association by any means is lying. It's just that you know how that is. We have information, we have data, but yet how we present it can sometimes really impact on the understanding of things. So it's going to be nice for your discussion board that you have read through both of these. And an optional, just optional, because I know you've got enough, but an optional reading that might help you with your vulnerable population assignment number 3 is to look through the Joint Commission requirement. And the reason I like this is because, let's take a quick look, just because it is optional. So let's take a few minutes. And in this, that was in this new requirement as of January 2023, there's requirements that hospitals have now that the Joint Commission requires, and you can see what the standards are. But it's kind of hard to read through, but they have a good introduction, so you would want to read that. And then you can look at the requirements. So EP1, that the organization designates a person to lead activities to reduce healthcare disparities for their patients. Now, do you know who that is at your organization? And then if you could see E2, that the organization assesses health-related social needs to provide information about community resources and support services. So again, the organization determines which health-related social needs are going to be assessed. And that could be transportation, paying for prescriptions or medical bills, which I think often hospitals do, education and literacy, housing and food insecurity. So you see these really can be community outreach for your vulnerable population. Rationale for that one, these are Joint Commission requirements. EP3, that the organization identifies healthcare disparities in its population. So which healthcare disparities are they, really looking at based on the population of patients they serve? And I think maybe this is the final, developing that written plan of action that describes how the organization will address at least one of these disparities. So there's EP5, and that's the end. So it looks like a lot, but you just need to go through those. The main takeaway is please look at in your hospital, if you're working in a hospital, who's responsible for these Joint Commission standards, and maybe reach out and speak with them. Have a good day.